Hello guys, welcome to this YouTube channel. Today I'm going to discuss with you another topic, that is cynosis. It is also known as the blue baby disease. It is mostly found in the newly born babies. It is a type of the cardiovascular disease and it is congenital in nature. That means it is developed during the birth of an individual. As far as this disease is concerned, it is basically the combination of two words. One is cyno and cis. Cyno means the blue colorization and cis means the condition or complication. So according to the definition, it is the condition or we can say the complication in which the baby's color becomes blue due to increase in the level of deoxygenated blood in the body of the baby. So how this blue colorization occurs? This is a physical phenomena. This we will discuss here. So what happens is when the level of deoxygenated blood increases in the body of the baby, this deoxygenated blood will circulate throughout the body of the baby through capillaries, through arteries, through veins. And when the normal light falls on it, it will reflect the light of blue colorization due to the natural phenomena or due to the physical phenomena. So this is the main reason behind the blue colorization of the body of the skin. So how this blue colorization occurs? This mostly occurs due to increase or elevated level of deoxygenated blood in the body of the baby. So what is the cause behind this disease? How this level of deoxygenated blood increases when the baby is born? The cause behind this disease is foramen of ovary does not close after the birth of an individual. So what is this foramen of ovary? So what is this foramen of ovary? This we will discuss here with the help of this diagram, with the help of this simple diagram. Suppose this is the diagram of the baby which is not yet born. This is the simple diagram, in other words, we can say. This is the diagram of the baby which is not yet born, which is inside the mother's womb. So this foramen of ovary is actually the hole, or we can say the opening, which is present between the two atriums of the heart. And the function of this foramen of ovary is to carry the oxygenated blood from this right atrium to the left atrium and then to the left ventricle. As we know that the oxygenated blood directly comes from the umbilical cord of the mother, and this goes through this inferior vena cava, then into the right atrium, then through this opening it goes into the left atrium, then through this left ventricle, and this left ventricle then pumps it into the body. So this is the normal phenomena. In by So after when the baby is born, this foramen of ovary gets automatically closed due to the automatic phenomena. In certain cases, if this foramen of ovary does not close, and this will produce a condition or the complication known as the cynosis. So what happens in the cynosis actually when the baby is now born, the blood which comes to the heart is deoxygenated blood. Deoxygenated blood comes through the different tissues, different cells, from the different organs, and this comes through this inferior vena cava into the right atrium. When this opening will not close, the ratio of deoxygenated blood will increase here. There will occur a mixing of the deoxygenated blood between these two arteries, left atrium and right atrium. So in this way, the level of deoxygenated blood gets increased and it will produce the condition known as the cynosis. Due to this cynosis, different types of symptoms will arise in the baby. Some of them I have discussed here and discussed here. The So, what are the symptoms which are mostly found in the cynosis when this foramen of ovary does not get closed? Includes the bluish skin. The child's skin becomes blue color that I have already mentioned due to increase in the level of deoxygenated blood. And the baby will go through the breathing difficulties, and then through the chest pain will also occur when the ratio of deoxygenated blood will get increased. Dizziness, fainting, and feeding difficulties will also occur, and death may be occur in the several cases if this is not treated immediately. And so what is the treatment behind this disease? How can we cure this disease? The treatment behind this disease is intake of oxygen. The baby needs to give the oxygen. In certain cases we can do the surgery like open heart surgeries and catheterization.